Assalamu alaikum and a very good day to all of you. My name is Dr. Abdul Momin and I'm currently serving as Assistant Professor of Nutrition at National University of Medical Sciences, Rawalpindi, and also as a consultant clinical dietitian at one of the private hospitals in Islamabad. So, first of all, I would like to thank the organizing committee of this particular conference for letting me share my research findings with all of you. So my today's presentation is titled as Co-Administration of Prebiotics and Iron Fortificants Improves Iron Deficiency Anemia Among Women. So I'll be starting off with the introduction and a very brief review of literature. Then we will proceed towards materials and methods, results, conclusion, and some recommendations. So all of us know that the current world population is approximately 7.7 billion, and it is growing at a rate of 1.4%. Now projections tell us that by the year 2030, our population will be around 8 billion. And along with that increase in population, definitely there will be increased food requirements. However, micronutrient deficiencies, also known as hidden hunger, continue to affect approximately 25% of world's population, which is definitely a huge, which is a very alarming figure. Most common micronutrient deficiencies include those of iron, iodine, zinc, folate, vitamin A, and vitamin D, not necessarily in the same order as I have mentioned here. There are many poor consequences related to micronutrient deficiencies, which include stunting and wasting among children, then mental retardation, decreased capacity to do work, and premature deaths. All the age groups can be affected by micronutrient deficiencies, yet infants under 5 children, women of reproductive age, pregnant and lactating women, and elderly are at the biggest risk of micronutrient deficiencies. Well, as far as micronutrient deficiencies are concerned, iron deficiency is deemed to be the most prevalent form of micronutrient deficiency around the world. And it exhibits itself primarily in the form of anemia. Anemia exists in various forms, but the most common form of anemia is iron deficiency anemia. Now, coming to the brief review of literature, we know that prebiotics are those food substance components which move to the colon to ferment bacteria, and they improve the host health. There are many health benefits associated with prebiotics, such as prevention of certain types of cancer, such as colon cancer, reduction of cholesterol levels, improvement of inflammatory bowel disease. Then they also indirectly help in the weight loss. And some of the recent studies have suggested that prebiotics also help in the absorption of minerals, such as calcium, iron, and magnesium. Now, we can derive prebiotics from foods such as chicory, onion, banana, barley, oats, garlic, chickpeas, bran, and many others as well. Now, I would not be going into the detail of how prebiotics are supposed to enhance absorption of minerals. However, if this hypothesis is deemed to be correct, then prebiotics can have dual benefits. That is, on one side, they would improve the gut health, and on the other hand, they would also improve the absorption of these minerals, so micronutrient deficiencies can be prevented. Coming to the epidemiology of iron deficiency anemia, very quickly, 50% of all pregnant women worldwide are suffering from iron deficiency anemia, and this also contributes to about 0.8 million deaths every year, which is again an alarming figure. The situation in Pakistan is also quite worse. According to the most recently conducted National Nutrition Survey 2018-19, about 41.7% women of reproductive age group in Pakistan are anemic. For the prevention and treatment of iron deficiency anemia, the World Health Organization proposes 4 strategies, which include food fortification, dietary diversification, iron supplementation, and biofortification. Now, this particular research was focused on food fortification, which is the practice of deliberately increasing either a vitamin or a mineral to the food so that its nutritional quality can be enhanced. Many different fortification vehicles can be used for this purpose, such as milk or milk products, oils and fats, breakfast cereals. But cereals have been found to be the most effective ones because, number one, cereals are the staple food, then they are cost effective to be fortified with different vitamins or minerals, then they have got better acceptability, and also there is low incidence of toxicity in case of cereals. The objective of the current research was to probe the synergistic effect of 2 prebiotics, inulin and galactooligosaccharides, and 2 iron fortificants, sodium iron EDT and ferrous sulfate, on MCV, which is mean corpuscular volume, MCH mean corpuscular hemoglobin, and MCHC mean corpuscular hemoglobin concentration levels in iron deficient women of reproductive age. Now, what we did was we designed a double-blind randomized control trial, which was of 12 weeks duration, and we took university-going iron deficient female adults 18 to 25 years of age as our study population. All willing female adults were included in the study who did not have any co-mobs, while those females who were either married or who were already taking iron or prebiotic supplements were excluded from the study. There were 75 women in total. There were 5 groups made, 15 females in each group, so 15 into 5 equals to 75. So for the purpose of this, we prepared the fortified wheat flour with iron and with the help of iron and prebiotics. These were given to the participants on a weekly basis, and blood samples were taken from the overnight fasted women at baseline, 30th, 60th, and 90th day of the study. So this is the treatment plan which we used. So group G1 got 963 mg per kg of inulin and 10 ppm of sodium iron EDTA. Group G2 got inulin at the same dose along with 20 ppm sodium iron EDTA. Group G3 got 963 mg per kg of Gauze along with 15 ppm ferrous sulfate, and group G4 got 963 mg per kg of Gauze along with 30 ppm ferrous sulfate. Group G0 was obviously the control group, which was not given any prebiotic, but they were definitely given iron fortificants. So ethically, and there was no issue in that as well. So we determined the MCV, MCH, and MCHC as per their respective protocols. We analyzed the results using Minitab. And we used the factorial design. All the ethical considerations were ensured, and our trial was also registered at the clinicaltrials.gov, which is the world's largest clinical trials registry database. Now, this slide shows the mean square values for MCV, MCH, and MCHC. As you can see, that the mean squares for all these three parameters show that in terms of groups, study intervals, and the interaction between groups and study intervals, there existed significant differences, which is shown by the asterisk here. So this graph shows that when the women were fed with iron and prebiotic fortified flour, their MCV levels were significantly increased over the 90 days. Same was the case with the MCH and MCHC levels. So as we continued giving iron and prebiotic fortified flour to the women, all these three parameters were significantly improved, which showed an increase in the iron levels. So what we recommended was that all the stakeholders should be involved to address the problem of iron deficiency anemia in Pakistan. The government should make it mandatory for all the wheat farmers to fortify wheat with iron, and definitely stronger linkages between academia and industry are needed so that such focused researches can be done even further. Here are some of the references. If you have any questions, feel free to ask. I'll be happy to answer. Thank you so much and have a good day. Allah Hafiz.